Good afternoon. I'm Dr. Catherine, a board certified urologist who spends every working day talking about real men, real bodies, and real science. One of the most common questions that crosses my desk is, Doctor, am I giving myself erectile dysfunction by masturbating too often? The short answer is no. Self pleasure itself does not damage the erectile tissues. The long answer is more interesting because it reveals how timing, neuro-hormonal chemistry, and age weave together to decide whether you'll be ready for an encore or stuck on the sidelines. Give me the next few minutes and I'll translate the latest data into a practical roadmap for you without leaning on pharmaceutical shortcuts or pseudo-mystical advice. Every erection is a coordinated symphony of nerves, blood vessels, smooth muscle, dopamine, and nitric oxide. When orgasm occurs, the performance must end so the system can reset. Nature calls this interval the refractory period. Research published in 2021 in the Journal of Sexual Medicine shows that three biochemical events underscore that pause. Dopamine levels plummet, prolactin surges, and sympathetic nervous activity rises. Those shifts temporarily suppress the parasympathetic, rest and reproduce circuitry that makes erections possible. In men in their 20s, the neurochemical reset is swift, often complete in 30 to 60 minutes, occasionally even faster. By the seventh decade, however, the same reset can stretch to 72 hours or more. Vascular compliance has declined, testosterone has dipped, and pelvic floor tone is reduced, so the entire orchestra needs extra time to tune up again. To spare you endless spreadsheets, convert age into a recovery estimate with one back-of-the-napkin formula. Divide your age by 10, square the result, and you'll arrive, astonishingly often, at the number of hours your body prefers before it can reliably achieve the next rigid erection. A 20-year-old? 20 divided by 10 squared equals 4 hours, which clinically matches the 40-minute to 1-hour median we see. A 60-year-old? 60 divided by 10 squared equals 36 hours, identical to data from a 2020 European urology study that clocked the average refractory interval in that age group at about a day and a half. The numbers aren't perfect. Biology never is. But they're close enough to keep most men from mislabeling normal physiology as pathology. When the refractory interval is ignored and stimulation is repeated prematurely, blood inflow can remain sluggish, resulting in a half-mast erection that feels like erectile dysfunction, even though the penile tissue is perfectly healthy. In my clinic, I see this frequently in men over 40 who have maintained a teenage cadence of daily or twice-daily masturbation. They interpret the subsequent incomplete rigidity as disease, not realizing they're simply racing a stallion that has not caught its breath. Large-scale survey data, over 12,000 participants in the 2020 Global Self-Pleasure Study, show that exceeding your personal refractory capacity by more than 40% correlates with a fourfold spike in transient erection difficulties. That is not irreversible damage. It is temporary neurovascular fatigue. Once stimulation is scheduled in harmony with the body's recovery window, firmness usually returns within days. You may have heard anecdotes of men achieving multiple ejaculations without losing rigidity. They exist, but they're statistical outliers, not a hidden talent every man can unlock with a weekend workshop. Physiological measurements in these individuals reveal unusually low post-orgasmic prolactin release and a remarkably efficient parasympathetic rebound. Neither hormone therapy nor pelvic floor training has reliably reproduced the phenomenon in randomized trials, so chasing that unicorn often ends in frustration. Phosphodiesterase 5. Inhibitors such as sildenafil and tadalafil can, in fact, override refractory fatigue by enhancing nitric oxide-mediated blood flow, but using them solely for recreational timing pushes the cardiovascular system unnecessarily and can blunt natural erectile signaling over the long term. Instead, optimize the 3 pillars your own body already uses to shorten recovery: sleep, strength, and parasympathetic tone. 7 to 8 hours of consolidated sleep raises nocturnal testosterone secretion by up to 30%, a finding confirmed in a 2022 meta-analysis from the Endocrine Society. Resistance training 3 times per week, increases baseline testosterone, and improves endothelial function, both key to rapid erectile readiness. Finally, daily diaphragmatic breathing or mindfulness practice for 10 minutes shifts autonomic balance toward the parasympathetic branch, lowering refractory duration by an average of 20% in a 2020 Scandinavian trial. None of these strategies risks the priapism, visual disturbance, or tachycardia that can accompany casual PDE5 use. If you notice stronger, longer lasting erections after reducing masturbation frequency, what you're observing is not proof that self pleasure causes erectile dysfunction. You've simply aligned your behavior with a neurohormonal timer that lengthens steadily with age. Understand that timer, respect it, and performance nearly always rebounds. Should true erectile dysfunction, persistent inability to achieve or maintain rigidity, persist despite aligning with your personal refractory rhythm, consult a urologist. Cardiovascular disease, diabetes, or medication side effects may be in play, and early evaluation can be life-saving. Healthy sexuality is about rhythm, not restriction. Treat your neurovascular system as you would any finely tuned engine. Rev it, but give it adequate downtime. Fuel it with sleep and nutrition, and keep the stress meters out of the red. Follow that approach, and the odds of crossing your personal finish line today, tomorrow, and decades from now remain solidly in your favor. Stay curious, stay informed, and as always, take small, evidence based steps toward better health.